I presented on a randomised controlled trial that we did in Melbourne, Australia, really looking to see if we can make monovision better using the IC8 small aperture lens. Small aperture technology is a different way of improving depth of focus for patients after cataract surgery. So what we did with this study was have 20 patients in each group, so 80 eyes altogether, and we randomised them to receive one of two different ways of achieving monovision. So in the IC8 group, what we did was achieve emmetropia in the dominant distance eye, and in the non-dominant eye we used the IC8 lens with a minus 0.75 aim. That's a small amount of monovision, but because of the increased depth of focus with the IC8 lens, the patients were able to achieve a good depth of focus. In the other group, they also received emmetropia in their dominant eye for distance, and in their non-dominant eye we aimed for what we call a modest monovision, which was a minus 1.25 aim, and that enabled the patients to achieve also a good range of vision. The main outcome measures that we were looking at were distance across all of the usual distances, plus patient satisfaction. What we found was that both groups had extremely satisfied patients, but in the group with the IC8 lens, those patients had, as we would expect, a better distance vision because we had less of a myopic aim in that group. But both groups achieved the same range of vision, so both groups achieved a very high rate of spectacle independence across distance, intermediate and near, with the IC8 group having less of a difference between the two eyes. The satisfaction rate was really high. We rated them along the usual line of questions, and both groups were extremely satisfied. The symptom scores were very low in both groups, so things like glare and halos just didn't occur in either group, and patients were really getting about most of their daily activities without glasses. The take-home message is that monovision is a very good option for patients. It's extremely common in the United States, but we think that it can be made even better using small aperture lenses such as the IC8.